There are so many myths and misconceptions that abound regarding sunscreens in people of color.
Patients of color actually do need sunscreen. I think there is a long-held myth that patients of color do not need sunscreen.
People of color can and do sustain sunburns.
There is a decreased risk of skin cancer in people of color, but it's not a zero risk.
Also, many people of color are on medications that make them more sensitive to the sun. Their medications for diabetes, hypertension could cause them to burn or develop certain rashes. Our skin burns, we develop dark marks and discolorations, and we can even develop aging, signs of aging. It's very important for skin of color patients to know they need a broad spectrum, SPF 30 or higher sunscreen, but a sunscreen that contains iron oxide.
Look for a tinted sunscreen, which means a sunscreen that has something called iron oxide, which gives it a little bit of a tinted appearance. And the reason for that is twofold. One, it can actually be a little bit more cosmetically elegant on melanated skin, meaning you don't have to deal with the dreaded white cast that some people associated with sunscreens. And then two, tinted sunscreens give extra protection against something called visible light. And so if you have hyperpigmentation, if you have melasma, if you have sunspots, visible light can actually make that worse. And so by wearing tinted sunscreens and protecting against visible light, it tends to work better for people who have those conditions.